During auscultation, have the patient breathe deeply through his mouth. If the patient becomes uncomfortable, allow a rest period. Now let's listen as the examiner auscultates. If you hear bronchial or bronchovesicular breath sounds where they should not be, listen for transmitted voice sounds.
Now I want to say 99, please.
While auscultating the chest, ask the patient to say 99.
99.
Voice sounds that are louder and clearer than normal are called bronchophony.
99.
This time, would you say E?
Then have the patient say E.
E.
When E sounds like A and has a nasal quality, egophony is present.
E. E.
This time, would you whisper 1, 2, 3, please?
Finally, ask the patient to whisper 1, 2, 3.
2, 3.
When these sounds are louder and clearer than normal, whispered pectoriloquy is present.
3.
All these changes in voice sounds suggest the air-filled lung has become airless.
I'll continue looking at your chest again. Just breathe normally.
To examine the anterior thorax, have the patient lie supine and breathe normally. Observe the condition of the skin and inspect the chest for deformities, asymmetry, and respiratory movement. Next, palpate the chest to locate any areas of tenderness or to assess any lesions or abnormalities.